On this Sunday night, a leading killer. COVID-19 is becoming one of the top causes of death in Alberta.
Death is a late metric. Death is a very late metric.
Is the province too late with its restrictions? Patiently waiting for the vaccine.
We don't want to waste a single drop of this liquid gold.
How long before lockdowns can be eased in Ontario? Plus, former Prime Minister Brian Mulroneys' health scare while on vacation. And oh, Christmas tree, where are you? The shortage of this tall tradition.
Global National with Robin Gill.
Good evening and thank you for joining us. Today is the day the first doses of the COVID-19 vaccine are slated to arrive in Canada, a pivotal point in this pandemic. Here's what we can tell you about the initial rollout. The first batch of the Pfizer BioNTech vaccine, 30,000 doses, will be divvied up among 14 distribution sites across the country. Each jurisdiction has decided who gets the vaccine first. That includes frontline healthcare workers and long-term care residents. Shots could be administered in some places as early as tomorrow. It's what everyone has been waiting for, but some provinces are still struggling to bring down the number of new infections. Ontario saw just over 1,600 new cases in the past 24 hours, a slight drop from yesterday. Quebec reported nearly 2,000 new cases today, and it now has recorded at least 7,500 COVID-related deaths since March. Alberta recorded its deadliest day of the pandemic, with 22 lives lost, and there were more than 1,700 new infections reported in the province. Alberta has more than a quarter of Canada's active cases, despite having only about 12% of the country's population. And that has forced the provincial government to implement new restrictions. Starting today, hair salons are closed. Bars and restaurants have moved to takeout only. But as Heather Yourex-West explains, health experts still believe hospitals can expect an increasing number of patients, and families can expect to see more loved ones die.
Roger Maxwell died last week of COVID-19. The correctional peace officer worked at the Fort Saskatchewan Correctional Centre near Edmonton, one of more than 200 facilities in the province experiencing an outbreak.
Once you get to this level of community transmission, there's a much higher likelihood that any one person in any given group might be infectious and not yet aware that they're infected.
Approximately 700 Albertans have now died of COVID-19, making it the sixth leading cause of death in the province, coming behind dementia, chronic heart disease, lung cancer, COPD, and heart attacks. But with more than 20,000 active COVID cases, Alberta will see additional deaths in the coming weeks.
Death is a late metric. Death is a very late metric. So when you start to see a rise in cases, you wouldn't expect to see a rise in hospitalizations for a few weeks after that, and then you wouldn't even expect to see a rise in deaths until a couple of weeks after that.
Alberta doctors began calling for tougher restrictions in early November, but it wasn't until this past week that the Premier agreed to close things like restaurants, casinos, and hair salons. Businesses were given 4 days before measures took effect Sunday, making the lead up to the shutdown incredibly busy.
For me personally, I've just jammed 13 days, working days, into 4 15 to 18-hour days.
It's hoped the restrictions will reduce the number of new infections, but with Christmas less than 2 weeks away, the stakes remain very high. Indoor gatherings are a leading cause of transmission, and even if just a small number of people ignore the rules, COVID-19 numbers could continue to rise.
My recommendation is, remember, keep your contacts as low as possible, and preferably nothing outside of your household. We all have our part to play in it.
Hospitals in Edmonton have had to cancel non-urgent surgeries and other procedures as they get ready for more COVID-19 patients. The number of people in need of hospital care already expected to double before New Year's Eve. Heather Yourex-West, Global News, Calgary.
Ontario is set to begin its first round of COVID-19 vaccinations on Tuesday, but there still aren't enough doses to go around to everyone, so it will be months before the true scope of this national vaccination plan will be realized. That has health experts and politicians warning Canadians not to let their guard down. Here's Morgan Campbell.
You don't have to look very far outside of Toronto to find those traveling beyond the city limits to fulfill holiday shopping lists. They are lined up inside and outside of malls where shopping is allowed.
Hopefully we can all learn to wear masks and, properly socially distance, and hopefully that helps curb the spread sooner rather than later.
But relief may be on the horizon. Ontario expects to receive 6,000 doses of Pfizer's COVID-19 vaccine on Monday and will give them to approximately 2,500 healthcare workers at a hospital in Toronto and another in Ottawa.
We don't want to waste a single drop of this liquid gold. And we need to make sure that we have backup upon backup upon backup.
With about 14,000 doctors in the province, another 100,000 nurses, and 70,000 people connected to long-term care, the rollout process is expected to take a while.
This will have no effect in the short term. We need to get hundreds of thousands of doses quickly to have any sort of meaningful effect.
Which is why Canadians can't let their guards down.
We've got a hard couple of months, if not more, looming at us. And it's easy to lose sight of that fact when we're focused on the miracle of the vaccine.
A major concern among some Ontario mayors, people will become more relaxed with public health measures.
The major problem is that people have to stop having those social gatherings.
We're going to have to do it probably for another 12 months, but be patient. We're on the path to recovery.
Medical experts believe that these smaller shipments of the vaccines will actually allow provinces more of an opportunity to iron out logistical concerns moving forward. Meanwhile, the province of Ontario is expected to release more details Monday once the vaccine arrives here on Canadian soil. Robin?
Morgan Campbell in Oshawa, Ontario. Thanks, Morgan. The first doses of the Pfizer BioNTech vaccine rolled out of a plant in Michigan this morning, headed to healthcare workers across the United States. But it could be months before they're all vaccinated. And the numbers in the U.S. are overwhelming. Over the past week, there has been an average of 208,000 cases per day. As Jennifer Johnson reports, Operation Warp Speed can't move fast enough.
As the first vaccine doses were loaded onto trucks bound for desperate healthcare workers, Pfizer employees cheered. The trucks left the company's freezer farm in Michigan under the protection of U.S. Marshals, a military-like operation to battle this pandemic.
We're shipping 2.9 million doses of vaccine, so whenever they get them in arms, that's 2.9 million people getting vaccinated.
The freight trucks are specially outfitted to keep the vaccines in extreme low temperatures, custom critical written on the side of the FedEx trucks.
They're the highest priority of anything that we're carrying in our system.
The vaccines are being sent over 600 predetermined sites. Inoculations of healthcare workers will start Monday or Tuesday, but it will take weeks, possibly months, for everyone on the front line to be protected.
To get our staff done, we're looking at getting into February. And then that's even before we can get to our patients. So we've got a long haul.
Operation Warp Speed hopes to have 40 million doses delivered by the end of December.
And as you all know, this is our peak season. So this is the busiest time for us, but we made capacity in our network because we knew these vaccines were so important.
Later this month, teams from CVS and Walgreens pharmacies will start administering vaccines to residents in 75,000 nursing homes and long-term facilities.
According to the CDC guidance to the states and the pharmacies, that they can't begin until 12/21. They'll work through getting the consents in place from the individual patients and their family members.
As Pfizer's stock dwindles, the FDA says it will move as quickly as possible in approving the Moderna vaccine and others. But the biggest challenge could still be convincing people to get the shots.
All of them are 100% efficient in terms of blocking hospitalization and serious illness. So take whichever you can get first, and the sooner you will be protected.
Healthcare experts are again begging Americans to stay vigilant, concerned about surge upon surge of the deadly virus now and after the Christmas holiday. Jennifer Johnson, Global News, Washington.
Germany announced a hard nationwide lockdown aimed at curbing infections. Starting on Wednesday, all non-essential shops, schools, and hair salons will close. Private gatherings will remain limited to no more than 5 people from 2 households. Despite the country's early success in containing the virus, a recent partial lockdown has failed to prevent a rise in cases. The latest figures show cases have increased by 20,000 for a total of 1.3 million confirmed cases and more than 21,000 deaths since the beginning of the pandemic. Doctors treating Brian Mulroneys say the former Prime Minister is expected to make a full recovery. Mulroney was rushed to a Florida hospital Friday night and underwent emergency surgery. In a tweet, his daughter, Caroline Mulroneys, says her father is feeling better and is now resting at home. Sources close to the family say his wife, Mila, noticed something wasn't right with her husband and called 911. The Mulroneys are vacationing in Palm Beach, Florida, where the family has wintered for several years. Besides COVID-19 cases, Alberta has the highest rate of syphilis in Canada. Now, researchers at the U of A are trying a strategy. It's a 2-for-1 test that also looks at HIV. As Sulin Go reports, the results take just 5 minutes, so the patient can get treatment sooner.
2 new rapid tests for HIV and syphilis involve a finger prick and a plastic device, similar to a home pregnancy test.
It has a controlled dot that will show up on the surface, and then 2 other dots if the test is positive for syphilis or HIV.
Infectious diseases specialist Amita Singh is leading a U of A study to test both tests for potential Health Canada approval, screening 1,500 at-risk people in Edmonton and Northern Alberta.
So I'm really excited to give this a try here in Edmonton, where we have incredibly high rates of syphilis right now.
Edmonton has the highest syphilis rates in the country, with more than half of Alberta's 1,600 cases in the first 9 months of this year. In that same period, 23 babies were born with syphilis in Alberta. Another 7 were stillbirths. In 2019, Edmonton also made up nearly half of the province's 250 cases of HIV.
If you have an infection with syphilis, you're much more likely to get HIV if you're exposed to it at the same time as well.
The rapid tests produce results in 5 minutes. Then patients are treated for syphilis on the spot. Standard lab tests can take 2 weeks for results.
Currently, in some settings, we lose about 20% of people to follow-up, so they don't return for a test result, or there's a significant delay before they're located and offered treatment.
Syphilis often affects hard-to-reach populations, people with unstable housing, mental health issues, or addictions. Dr. Singh says sexually transmitted infections and high rates of meth use in Edmonton go hand in hand.
And we know that stimulant drugs change and influence people's sexual behavior.
Untreated syphilis can lead to vision and hearing loss, heart attack, and dementia. It can cause developmental delays in babies if they survive. Sulin Go, Global News, Edmonton.
Hundreds of students have been abducted in Nigeria. A group of armed men targeted an all-boys school. Police say about 200 students managed to escape, but as many as 400 are still missing. Those who did get away say the gunmen demanded money and ransacked their lockers. Government troops have reportedly found the area where the gunmen are holding the students hostage. Parents have been gathering at the school in the hopes of learning the fate of their children. The UK and the European Union have once again agreed to extend post-Brexit trade talks after missing today's deadline. A call was held between British Prime Minister Boris Johnson and the EU's Commission President. They insist there is hope that a deal will be reached, but they can't agree on fishing quotas, and the EU is concerned about competition with British companies getting financial support from the government.
I'm afraid we're still very far apart on some key things. But where there's life, there's hope. We're going to keep talking to see what we can do. The UK certainly won't be walking away from the talks. I think people would expect us to go the extra mile.
Technically, the deal is supposed to be done by December 31st. The Prime Minister admits that likely won't happen, but says British negotiators will not walk away from the table. Tonight, John Le Carre is being remembered as one of the best storytellers of our time. The master spy author passed away at the age of 89 from pneumonia.
There is a mole right at the top of British intelligence.
His fans may remember his book Tinker Tailor Soldier Spy being parlayed into a blockbuster. His real name was David Cornwell, and his career spanned 25 novels. Many were bestsellers. A humanitarian and giant of literature, he was awarded Sweden's Olof Palme Prize this year for his extraordinary contributions to democracy. He gave the prize money to Doctors Without Borders. Coming up, Cape Breton cut off, the turbulent times for university students. Cape Breton, Nova Scotia is feeling cut off. There are no commercial flights flying to or from the island, and the region is home to a major university. 60% of its student population comes from abroad. Tonight, there are concerns that number will take a nosedive with a lack of air transportation. Here's Ross Lord.
As an island connected to the mainland by a causeway, Cape Breton can feel remote. Even more so now after both WestJet and Air Canada have cut air service, eliminating commercial flights after January 10th.
The news about the reduction to essentially nothing of commercial air service for Cape Breton Island is essentially catastrophic.
Air Canada says it regrets the impact on customers, but says without specific financial support from government, it's increasingly difficult to operate in the pandemic. The airline says it's carrying less than 8% of normal passenger volumes. Air Canada's cutbacks are the third round of reductions in Atlantic Canada in the past 6 months. They leave Halifax down from 21 destinations within Canada last year to 6. St. John, New Brunswick is left with no commercial flights. It's the same result on Cape Breton Island, leaving travelers 4 hours away from the nearest airport, even longer in bad weather. And that may impact Cape Breton University. More than 60% of students come from other parts of the world. The influx of international students has spurred population growth on the island for the first time in decades. A success story that could turn sour.
I think losing our airport will not only affect the ability of the current students to travel freely, but also impact the decision of the future students to come to Cape Breton.
The student union and political representatives are calling on the federal government to restore commercial flights. They hope the stoppage is temporary, that the end of the pandemic marks a return to normal air service. But that's far from certain.
You have to wonder whether or not what we've seen happen here with our regional local airport may be an early warning signal of things that may happen across the country. So everybody should be concerned about this.
More anxiety about the pandemic's ripple effect and how long it will last. Ross Lord, Global News.
Still ahead, will business trips bounce back? Why air travel faces a steep price if they don't. Despite the introduction of rapid COVID tests at some airports and the prospect of vaccines, air travel is still floundering. Airlines say they will lose $200 billion in 2020 and 2021. Business travel is a key component of the losses, and Microsoft founder Bill Gates predicts corporate travel will never return to pre-COVID levels. Redmond Shannon explains why that could make flying more expensive for all of us.
As 2020 progressed, the outlook for airlines only got worse. They say widespread airport testing is needed to encourage customers to return. But even after the pandemic, the industry may never be the same again.
Well, my prediction would be that over 50% of business travel and over 30% of days in the office will go away.
Microsoft founder Bill Gates might well say that. His company and those like Zoom have helped replace the business trip with the virtual meeting. But others agree it's part of a permanent trend.
Intercompany meetings seem to be a really good candidate because so much of what's happening with Zoom right now is that. It is the activity which does not involve clients and seems to be readily accepted by employees.
Jay Sorensen's aviation consultancy has predicted a permanent drop of 19 to 36% of business travel, specifically in areas like commuting, IT support and research work.
First-class cabins are not being filled with passengers paying $3,000, $5,000, $10,000 for a ticket like it was pre-pandemic.
And that will become a huge problem for many airlines who rely on that revenue to subsidize cheap tickets for the rest of us.
$300 transatlantic fares that we're seeing now can't possibly exist and the airlines stay in business, and they'll have to make up for that some way, and that probably means higher economy fares.
It could reshape airline business models, forcing them to shift focus toward trips that are irreplaceable.
The thrill of being someplace, of tasting local food, of the smells, of the sights, of the wind in your hair, can't be replaced by technology.
So one of the long-lasting effects of the pandemic may simply be that our vacations cost a little bit more or become a little more rare. Redmond Shannon, Global News, London.
Up next, as COVID-19 cuts down businesses, why are Christmas tree sales going up? Many businesses are getting hit hard in the pandemic, especially during what should be a lucrative holiday season. But the Christmas tree industry is somehow booming across North America. It's performing so well, sales this season are already outperforming last year's numbers. So what's behind the growing demand? Mike Drolet explains.
Pandemic Christmas tree time. I thought at the time it was the COVID-19 cabin fever. After all, who cuts down a Christmas tree in mid-November? And here we go. But as it turns out, we were ahead of the curve.
People were there. Even a week before my farms were opening, people were stopping in, knocking on the door. Do you think I could cut a tree?
Sophie, you're carrying this? No. We dragged and bagged our tree, and not long afterwards, the farm put up a familiar sign. Closed for the season. Some farms shut before December 1st. That's never happened before. The industry started seeing the signs in July when it became evident the 2.2 million trees Canada exports to the U.S. every year weren't going to be enough. Drysdale's tree farm, about an hour outside Toronto for one, declined to sell all their stock to the U.S. at inflated prices.
I want to support those people that have supported us.
The numbers aren't in, but it's expected the increase in sales will be around 25–30%. And yes, it's all believed to be related to COVID in one way or the other.
Christmas tree farmers are telling me that this is a first of them being closed so that they can actually enjoy the season as well, because normally, right? Normally we're so busy, we're just going through the motions. And a lot of farms are open till December 24th.
Who knew the hottest toy of the season wasn't a toy at all? Mike Drolet, Global News, Toronto.
And that is Global National for this Sunday night. I'm Robin Gill. Tonight, your Canada is Winnipeg. We'd love to see your photos, so email them to viewers@globalnational.com. Thank you for watching. Donna Friesen will be here tomorrow. Have a great night.